The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm Don McIntosh, your host, and today we're joined with Dr. Philip Mills from Wichita, Kansas. Welcome, Dr. Mills. Today we're going to be talking about a very important subject, a subject that affects millions of lives, and that's pain, chronic pain. Why should we talk to someone like you about pain?
Because pain, as you said, affects virtually everyone. But it's interesting, Don. While everybody knows what pain is, we don't have a good definition for pain. Scientists that study pain argue over what pain exactly is and how to describe it.
So I believe one of your specialties is this, actually pain, pain, treating people with pain. A painologist. What do you, I don't know what you call that.
Well, it's a pain specialist. There is such a problem with pain, and people with chronic pain have to be treated differently than other kinds of medical problems. And so some of us have specialized in the area of pain treatment.
Is there anything good about pain?
Well, if you look at some very interesting patients that were born without any pain fibers, you discover some interesting facts. There was a fellow who was just a few years old, and his appendix needed to be taken out. It was difficult for them to find that he actually had an appendix problem because he didn't hurt. But after some studies, they discovered he needed to have his appendix out, and they did it without any anesthesia. He was able to go through all of the treatment of the
surgery and everything?
The surgery,
no pain
without
medication.
any pain medications, without any anesthesia. And you'd think that was good. But as the doctors looked at this poor boy that had no pain fibers, they saw he had joints that were deformed, and they also saw that he had scars all over his body. And they thought, this boy has been abused at home. And so they didn't realize yet that he had no pain fibers. And so they asked and investigated into the home situation and discovered that, in fact, he hadn't been abused, but that he had no pain fibers. And so when he injured his joints, if he burned his hand, there was no pain, no protection, no change of behavior, and consequently, he was deformed and scarred. And these people without pain fibers, their life is short, and they end up quite scarred, quite deformed. And we should realize that pain is actually one of the great gifts of God for our protection.
I know some people are probably saying, well, you know, that may be true, but for me, this situation that I'm in, I don't think it's much of a blessing.
Well, let me ask you this question. Suppose that you're a physician and I was a patient and came into your office, and you watch, and I have a hammer in my right hand, and I have this hammer smashing the thumb on the left hand.
Yeah, I might send you to the
and so
the pink coats.
Well, I say to you, I say, doctor, my thumb hurts. Please do something for my thumb. Would you say, here, take these pain pills? Or would you say, stop doing what's causing the pain to your thumb?
Like I said, I might send you to a different kind of doctor right away. But yes, I see your point.
The point is that pain was telling me I shouldn't keep doing what I was doing. And so in the majority of cases, we should look at pain as a protective mechanism, not as an enemy. And I've always been amazed that people, if they hurt themselves, will take God's name in vain. When they hurt themselves, they should thank God that they have those pain sensors so they can protect their bodies. In fact, if you look at the disease of leprosy, what leprosy does is it destroys your pain fibers. Some people think that leprosy just eats away the fingers and the toes. It doesn't. It makes it so that you don't feel. And so if an animal, let's say a rat, comes up and eats on your finger, doesn't waken you at night. If they gnaw on your nose, you don't awaken at night. And so gradually you may lose your toes and your fingers and your extremities because if it's infected, you feel no pain. Pain is important. One of the problems with sin is it deadens our pain, and so we'll sin, but it doesn't hurt. And so we keep on sinning. I'm told by my friends who are specialists in alcohol-related issues that the people who are apt to be alcoholics are not the ones that get hangovers, although sometimes it involves them, but the ones they tolerate the alcohol fairly well. They don't get sick. The ones who the first time they drank alcohol, they got a lot of effect from it. They got a lot of sickness. They tend to not drink. So pain, again, first of all, should be looked at as a good thing because it's protective.
So pain is protective, but that's acute pain or short-term pain. I mean, is that the way to use that word, acute?
Yes. The word acute simply means of short duration.
Okay.
So you would consider maybe up to 6 weeks, certainly 3 weeks, possibly 6 weeks, to be acute. After 6 weeks, so about 3 months, you'd call that subacute. And then after 3 months, you begin to refer to it as chronic pain. Now, chronic pain is different than acute pain. Acute pain has a clear cause, and it's reasonable in certain cases to give medication treatment for the acute pain to control it because it's going to go away. But chronic pain either is signaling that there is something still irritating the body, or it is signaling, if that isn't the case, it is giving signals to the brain that you have this danger when in fact there's no danger there. It is telling you need to change your behavior when in fact there's nothing you can change. And that becomes a problem.
So would you say it's overprotective or just
yes.
Or confused?
It's confused, where the signals to the brain are such that you're getting this pain, and yet there is no real cause of alarm that pain actually is signaling.
So less than 6 weeks is an acute pain.
Yes.
From 6 weeks to 3 months is a subacute pain.
Yes.
And from 3 months and on is a chronic pain.
And then the pain itself in a chronic situation over a couple years, the chronic pain itself begins to cause changes to the personality, begins to cause changes to the person. And so that chronic pain is where the real problems lie in pain management.
We want to talk about how to live with some of these pain situations, because I assume that some of them you just can't get rid of them.
Yes. A chronic pain I like to think of as this way. It's not something you die from, but it is something you may die with. And so how do you deal with this chronic pain situation?
Are there acute pains or short-term pains that can turn into long-term pains?
Yes. Let me give you a disease, for example, that is a real problem in the area of pain. It is an acute, severe pain. There's a long name for one of the kinds of pain. That would be tic douloureux. And this is a tremendous pain on the face that can come as sudden, sharp, electrical agonizing sensations here across the face.
How do you get that?
There's a certain nerve that begins to malfunction and send those signals to the brain. And even a little breath of air across may just set this off. And so a person becomes quite frightened to even get outside. It can change their life. And they'll seek for some solution, maybe even surgery that would cause their face to be disfigured. They'd rather have that than if they could get rid of this pain. That is how severe it is. Other types of severe pain include such problems as reflex sympathetic dystrophy. It's a long name for a problem that was originally seen in wars, where you'd have a bullet wound that would injure two nerves. And in the healing process, these nerves would short circuit.
Put the wires together.
They would be wired up in healing wrong, and you'd
see.
have this severe pain that would be constant and unrelenting. And you'd say, oh, the solution would be to cut off the hand. But the fact of the matter is, even after they cut it off, the pain would persist right where it was, just as if the hand was there. So it has been a real problem in management.
You know, I want to come back to what kind of things happen to people when they're suffering from chronic pain for a long time. I want to come back to that. But just a question that's not related so much to chronic pain. It's more an acute pain or, you know, one of those short-term pains you've described. What about a headache? What should you do for a headache?
Well, headaches can be a chronic pain.
Okay.
And that can be a major problem. The first thing, obviously, you have to have a clear workup to find out if there's some treatable problem, if there's some underlying issue, such as a tumor or some other
So a CAT
vasculitis.
scan or X-ray or something.
The doctors will work it all up fully. They know just exactly what to do for that. But in many cases, all of those studies are normal, but severe headache pain persists. Before a person should try powerful and potentially risky drugs, there are some things that take care of, in many cases, people's headaches. Some simple things that they can do. For example, if they can stop all caffeine products, that can cause headaches. Theobromine in chocolate.
Goodbye chocolate.
Some of the chemicals that are in cheese and wine. And then if you have tobacco, exercise, and meat has even been found to be a problem with headaches. And then I also have patients stop dairy products. And it is surprising in a certain percentage of patients with making these simple changes, the headaches will go away. In other cases, they will not. But it's certainly harmless and worth a try for at least 6 weeks.
So if you have a headache and it hasn't gone away, try going off some of these things you've mentioned.
Yes.
You mentioned in that list exercise. Did you mean to say that?
Yes, if a person can increase their exercise, but sometimes that's hard to do with a headache, sometimes increasing the exercise can be of benefit if it's a simple exercise such as walking.
So there really are some simple things that we can do to maybe address the problem of headaches. We've been talking with Dr. Philip Mills from Wichita, Kansas about pain. He's a specialist in pain management. And when we come back, we're going to be talking about chronic pain, what we can do to live with it. So we hope that you will join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who are able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, They present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Philip Mills from Wichita, Kansas. Dr. Mills is a pain specialist, and we've been talking about different types of pain, Dr. Mills. Acute pain, correct me if I'm wrong, it's from 0 to 6 weeks. Subacute being from 6 weeks to 3 months. And then a chronic pain that lasts anything longer than 3 months. What types of things do you see happening of many thousands of patients that you've seen when they have a pain that lasts for, longer than 3 months?
Well, what begins to happen are some interesting changes in the psychology of the person, the mental outlook. For example, after about 2 years of chronic unremitting pain, virtually everyone will have a substantial depression. And secondly, they will be completely consumed and focused on their bodily functions, and their pain, because it's part of every waking moment. There will generally be some financial problems because they may or may not be able to work, but typically they will not be working. And so you have these pressures. All of their friends are tired of hearing about their pain, and so in some cases it's bottled up. And these make changes in the way people deal with other people. They may become more solitary, and it impacts marriages. It impacts parenting skills.
Are they ever angry at you when they come in?
Well, I don't look at them as being angry at me, although they're just maybe angry. They're often quite angry at their employers, and if an insurance company has sent them to me to evaluate, they may look at me as part of a system that's not very helpful to them, and so they may be quite suspicious and quite angry. So that can be an aspect, but generally, if they are angry, they're really angry at themselves, but they seem to be angry at other people.
Do you find that some people, I don't know how to say this nicely, but do they need their pain, or do they, I don't know how to say that.
Well, you're talking about the psychological issues. Are all people with chronic pain, do they have a real reason for the pain? The fact of the matter is, in some cases, there can be a psychological component of pain, that pain provides a wonderful escape. And so they're a failure in life, and the reason is they could be successful, but they have this pain. They could work, but they have this pain. And in fact, there are times where we're able to completely take away the pain, but they're not happy, and they need the pain and quickly get it back, because for reasons of their life situation, it's the comforting blanket that gives them an excuse not to perform, not to help somebody else, not to reach out. It may also be that they get attention from a spouse. And so they have the pain, and then the spouse will wait on them. If they lost the pain, then they would lose the attention and being waited on by the spouse. So it is not unheard of to have patients, certainly I have had patients, where the pain had a psychological basis.
So let's assume that there are people watching today that actually have true chronic pain. They're not malingering. They're not trying to fool anybody.
Yes.
And they really have that chronic pain. What can they do to live with chronic pain?
Well, there are several suggestions that we have found helpful. And again, we're dealing with chronic pain. Now, chronic pain can have lots and lots of causes. And so for the first suggestion, but virtually everyone with chronic pain has done this, but they need to have a thorough evaluation to make sure that no medically treatable cause can be uncovered. If they're having chronic pain, because a surgical procedure needs to be performed, then that can be evaluated. Or if they need certain types of medicine to take care of the problem, that can be evaluated. But
assuming that's all done.
Because pain is so uncomfortable, virtually all my patients with chronic pain have had quite thorough workups.
Gone to many physicians, probably.
Yes, and they're quite frustrating. So then the next suggestion that we find helpful is perhaps the hardest of the group.
And is this what you start with when you talk to patients?
Well, I may not start with it, but this is one of the most important, and because we have limited time here, I want to make sure that I deal with it. But one of the most important ways of treating people with chronic, unremitting pain is to get them off their addictive medications.
Does that mean all medications? You're saying get off all pain medications?
Well, it may mean that. It should be done under supervision, because some medication, if you just stop, you may have seizures and some other problems. They may have to be weaned off it. But the goal here is to get patients off of their medication. And we find in many cases that the medication was providing not much relief, and we're talking strong narcotics. The medication was not providing much relief, but in fact was dulling their mind. And the reality is that the way to deal with pain requires a sharp brain. The brain will be able to deal with the pain. And if you dull that, you dull the very best vehicle that you have to handle chronic pain. Now, even in the acute situation, if you recall Jesus, when he was on the cross, they gave him some vinegar, which had been a pain reliever. And his mind was so important to him that as soon as he tasted it, he wouldn't take any more. That should suggest that the mind is very important in dealing with these stressors such as pain.
So there are some complications with medication, and one of them is not being able to really think through how to deal or cope with the pain. Well, that is a pretty hard solution, I think. Probably some people that are listening. What's another suggestion?
Well, after we work toward decreasing the medication, toward eliminating it, if it's possible, then another, and this is also difficult, another aspect, and an important aspect, is exercise. Now, a person would say, well, it hurts if I move this area. But not all pain is indicating that you should stop movement. Let me give you a sample. If you injured your elbow, or even if you didn't injure your elbow, but you immobilized it in a cast, and that is immobilized for 6 weeks, then you take the cast off. I don't know if you've ever broken a bone and had a cast.
Just ribs, but we couldn't put a cast on that.
If you then take the cast off and you start to move the joint, oh, it hurts. But what is the solution to the pain? More movement. And as you move it, it gets better. Many times a person has had a back injury, and the doctor has said, well, if it hurts, don't move it. And so the patient, they quit moving their back, and when you quit moving, the muscles shorten up, and the joint gets stiff.
Okay.
And so with that stiffness, then if you move it, it hurts. But we have found in certain types of back pain, the solution actually was special types of exercises, and it even involved machines that would help with those isolating exercises that actually stretched out those muscles. And although at first it hurt, with a bit of movement, the pain went away. Now, I found out in my own case that more exercise is very important. I started exercising about 2 years ago, very religiously in the mornings. But I only went about 2 miles. and I had some underlying musculoskeletal pain on a chronic basis, but it wasn't severe at all. But it is embarrassing, so that you don't dare let anybody know that you have pain, because I'm a pain doctor.
Okay.
And so I would try to hide it so nobody knew that I had hurt anywhere. However, with the 2 miles, I still had some discomfort. And after this summer, I increased my exercise to 4 miles.
You took your own medicine here.
A short time ago, I did 50-mile hiking up in the Rocky Mountains. And when I was done, I was absolutely pain-free. And so if a person can increase their exercise often, this is a very important aspect of pain relief. And many people stop when they begin to get sore.
And they really should keep going.
Yes. Now, it needs to be supervised. You don't want to injure yourself, but in most chronic pain cases, you are not in any danger of damaging your body.
Okay, so we've talked about stopping medications. We've talked about starting to move. We've said that's under advisement. Medications, you don't just stop them abruptly. You check with your doctor. You don't just exercise unless you really should be. You need to check with maybe someone like yourself. Anything else that, that patients should do or people should do that are dealing with chronic pain?
Yes. One of the most important is drinking water.
That sounds simple.
It is simple. But if your cells are relatively dehydrated, they'll send signals to the brain. And the brain may interpret those signals as being pain. And so if you make sure they're hydrated, that in it, by hydrated I mean you get plenty of water, that in itself may make a person feel like they're having less pain. Some of the pain was just misinterpretations for crying out for water. Now, in that regard, caffeine can dehydrate cells, and we also know that caffeine increases the pain that a person feels. So people should stop all caffeine. They should also stop all smoking for similar reasons.
Wow, so these are really practical things. Some of them are quite simple, drinking water and getting rid of some habits people want to get rid of anyway.
But there are also some spiritual components to this. Study Job and Jacob. And after Jesus touched Jacob, he had chronic pain.
So we need to look for some lessons within pain that maybe are not right on the surface, especially those that have chronic pain. Thanks for joining us today, Dr. Mills. I know you have a very busy schedule, and thank you for joining us, and we hope that today you've learned some things that will give you health for a lifetime.